Very last section of our chapter 28, our 4-part series for chapter 28. We're going to look at what's going to occur after birth, as well as if I can remember, lactation and some other things. I don't remember everything to its fullest, but we're dealing with everything that's going to occur after childbirth. Okay, so this word, puerperium, this is what occurs the first weeks after postpartum. So after you've given birth, that first 6 weeks is called a puerperium. And it's a period during which the mother's anatomy and physiology starts to stabilize and reproductive organs start to return to its normal state. So everything is returning to normal. We look at involution. That's the shrinking of the uterus. So remember, the uterus was this small at first, and then with the growth of this fetus, it increased to this length. So now it has to go back to its original size, and this is called involution. So the uterus loses about 50% of its weight in the first week, in lactating women. So those women that are breastfeeding, and it is this for in lactating women, and is nearly at its pre-gravid weight in week 4. So maybe it's almost back to its original state prior to pregnancy. That is called pre-gravid weight. That's pre-gravid, which is prior to pregnancy. About at 4 weeks, it returns to, it's nearly to its pre-pregnancy weight. Now, involution is achieved by self-digestion of uterine cells by their own lysosomes and lysosomal enzymes. Now, for about 10 days, this produces a vaginal discharge called lucai. I call lucai. Now, it's usually bloody at first, but then it turns into a cirrhosis type of fluid. Now, breastfeeding, as some may know, it helps to promote involution. Why? Because it suppresses the estrogen secretion, and then it stimulates the oxytocin secretion, which is pretty good. Now, it is important for the puerperium to be undisturbed, as emotional upset can inhibit lactation. So, what is lactation? Lactation is basically the synthesis and the ejection of milk from the mammary glands. Now, it lasts for at least a week after postpartum in women who do not breastfeed their infants, but it will continue for many, many years, as long as the breast is stimulated by a nursing infant or any type of mechanical device, such as a breast pump. So you do have some women that do continue to breastfeed their children even up to age 3. I do remember going to church one day, and I had my infant with me, and this lady had a 3-year-old with her, and she was still breastfeeding her child. So it is possible to still breastfeed. Now, women traditionally nurse their infants until minimum age of 2.8 years. I would say 8 years. 3 years. So it is, I have seen it personally. So it's not just what the book says, I've definitely seen it. Alright, so we do have, during pregnancy, we have a high estrogen level, and that causes the ducts of the mammary glands to grow and then branch off extensively, correct? So other hormones also contribute, such as the growth hormone, the insulin, the glucocorticoids, and the prolactin. Now, other hormones also contribute. Now the progesterone, they start to stimulate the budding and the development of the acini at the ends of these ducts. Now, in late pregnancy, the mammary acini and the ducts are distended with a secretion called colostrum. And this is very similar to breast milk in protein and lactose content. So they have, it's very similar to breast milk in that they have the protein and the lactose content, but they do not contain that 1/3 of fat. They have 1/3 less fat. So it's very similar. Now, it is an infant's own natural source of nutrition for the first 1 to 3 days after birth. It has a thin, watery consistency and a cloudy, yellowish color. It contains immunoglobulins, especially that IgA, and these may protect the neonate from gastroenteritis, which may be reabsorbed by the small intestines to confer any type of system-wide immunity. Now, milk synthesis is promoted by prolactin, which is a hormone from the anterior pituitary gland. Now, the prolactin secretion begins 5 weeks into pregnancy, and by full term, it is 10 to 20 times to its normal level. It has little effect on the mammary glands until after birth, when the levels of the steroids abruptly drop with the discharge of the placenta. Now, every time the infant nurses, the stimulation causes a surge of prolactin to 10 to 20 times normal for the next hour, and milk is synthesized for the next feeding. Now, these surges are accompanied by smaller increases in estrogen and progesterone secretions. Now, if the mother does not nurse or the surges are absent, the mammary glands stop producing milk in about a week. Now, even if the mother does nurse, milk production declines after 7 to 9 months. Now, nursing apparently inhibits this GnRH secretion and the ovarian cycling, and only 5% to 10% of women become pregnant again while breastfeeding. This is a small amount, 5 to 10%, so it is still possible. Now, even women who breastfeed, however, the ovarian cycle continues. It sometimes resumes several months postpartum. So here is just these little prolactin surges that occurs. This is pregnancy, this is after pregnancy, this is the lactating phase. And here are the different feedings. And during feedings, you have this surge of prolactin that is secreted. Okay? Alright, so milk, it doesn't going to flow easily into the ducts. The milk ejection or the milk letdown is controlled by the neuroendocrine reflex. So the infant's sucking on her nipple, it stimulates those nerve endings in the nipple as well as the areola, which in turn signals the hypothalamus and the posterior pituitary gland to release that oxytocin. Alright, so the slide changed just slightly. I wanted to add in this, I just added in this picture again. But this is what this information is talking about when we talk about milk ejection reflex. When the infant is in the process of receiving milk from his mother, it stimulates these nerve endings that you'll find here in the nipple as well as the areola. This in turn is going to stimulate the hypothalamus, which is within the brain. Going to stimulate the hypothalamus and the posterior pituitary gland right here to release this oxytocin. The oxytocin is then going to stimulate these myoepithelial cells, which form this basket-like net around each of the acini, which are in here, which we talked about in another video. These cells are going to contract like the smooth muscles to squeeze this milk out from the acinus into the ducts, even though they are of the epithelial origin. Now milk is going to fill these ducts and the lactiferous sinus within 30 to 60 seconds of the child actually sucking on the mother's of suckling. Sorry. Now the composition of the breast milk changes over the first 2 weeks. It varies from one time a day to another, and every changes during the course of the single feeding. Now, a cow's milk is not a good substitute for human milk. I repeat, cow's milk is not a good substitute for human milk. It has 1/3 less lactose, but 3 to 5 times as much protein and minerals. The large amount of protein is not digested and absorbed as efficiently. It's not absorbed properly, and it also increases the infant's nitrogenous waste excretion, increasing the incidence and severity of a diaper rash. So please, no cow's milk. Don't do all this milk. Breastfeed for all you females is very important. It's healthy for the baby as well. It helps in getting you back into shape quicker by reducing the size of that uterus. Alright. Colostrum and milk have a laxative effect that helps clear the neonatal intestines. It's that greenish black fecal matter that accumulated during fecal development. Now, by clearing the bile and bilirubin from the neonatal body, breastfeeding reduces the incidence and degree of jaundice in neonates. There's another reason why you need to breastfeed. Breast milk promotes colonization of the neonatal intestines with beneficial bacteria and continues to supply antibodies. Breastfeeding also tends to promote a closer bond between the mother and the infant. Not there yet. Now, a woman nursing one baby generally produces about 1.5 liters of milk per day. A woman with twins, obviously, she's going to produce a lot more. Now, lactation, it places a greater metabolic demand on the mother, who loses 50 grams of fat, 100 grams of lactose, and 2 to 3 grams of calcium per day. You want to lose that adipose tissue. You don't want it lingering around. I want to look good on that bathing suit again. Okay, so a woman is at a greater risk of bone loss when breastfeeding than when she is pregnant, because the infant's skeletal system becomes mineralized during the first year of postpartum. So yes, there's a downside, but if you are consuming the proper amount of food, the proper quality of food, it will not decrease too much. But still, there are other benefits. Alright, so let's look at methods of contraception, which is the very last area that we're going to look at. When we look at contraception, any procedure device intended to prevent pregnancy. We have behavioral methods, which is abstinence, rhythm method, which is periodic abstinence, withdrawal. Now we have certain barriers for male and female. We have the condom, the diaphragm, and the sponge. And then we have these spermicides as foams, creams, jellies. We do have hormonal methods. We do have that after the morning after pill, where you may feel that you have been you may be pregnant and you catch it very early. You can actually get these in the store, I believe. It's a high dose of estrogen and progesterone alone, and it induces menstruation if implantation has not occurred. Now, it inhibits ovulation, it inhibits movement of sperm and an egg, and inhibits implantation. Then you have this other pill here, this RU486 progesterone antagonist, which induces abortion up to 2 months into pregnancy. So these are the different hormonal methods. You have the pill, which is your estrogen and progesterone. You have the patch, the injection, or you have the vaginal ring. Then you have these other devices. You have an IUD, an intrauterine device. This is what it looks like. It's inserted in during your visit to your doctor, and it has a little string at the end that is left in place. So I guess periodically they'll go in and check the string to see if it's still there, if it's not too short, not too long. Make sure it's not interfering with anything. It's inserted through the cervix into the vagina, and you see how it blocks off any sperm from getting past here and into the fallopian tubes, or even meeting up with the egg. Okay. You have surgical sterilization, which is clamping, where you have clamping of the uterus, not the uterus, sorry, clamping of the fallopian tubes, or clipping of these tubes. Oh, it's on there twice. I'm sorry. Here we go. Here it is. Here are your fallopian tubes, and you have a cut and tie procedure where they tie the fallopian tubes, and then they cut in between. You have a sealed, where they cauterize the area. They have a band, a plastic band that they used, and then they have a block using a clip. They usually clip it here. So there are different ways of surgical sterilization. So methods of contraception, failure rates of contraceptive methods. Here we have the rate of failure pregnancies per 100 uses. No protection. Perfect use. You have 85 out of 100 users. The rhythm method, 3 to 5. Who would be the lowest? Well, abstinence would definitely be the lowest. But we're dealing with contraception. Tubal ligation, you have a 0.5. That's basically tying of the tubes, another term, layman terms. Birth control pill, the patch, or the uva ring, you see them down at 0.3 to 0.5, and the IUD, the intrauterine device, is actually pretty low at 0.2 to 0.6%. Well, of the 100 users have failed. So this one would actually be the best device to use than the birth control patch or the uva ring. But don't forget, with every single one of these methods, you do have side effects. So if for those females that are thinking of using contraceptive methods, make sure you read the side effects. Males, make sure you encourage your females to engage, and if you do want them to use it, make sure you both know the side effects, the pros and cons of all methods. Alright, so that is all for this last section. It's very short. If you have any questions, let me know, and I'll be willing to answer any questions. Alright, have a good one. Make sure you study for the test.